Good evening. I'm so glad that everyone is joining us this evening. We have a special presentation, our first of 2025, and Kidney Cancer Canada is stepping it up this year, so stay tuned. We plan to have lots of webinars, informational. Some may be only half an hour to keep you up to date on developments of what's going on in the kidney cancer world. But we have worked with our guest speaker tonight, Alan Birch, and he is from, and I'm going to use both Centrix and Haven, and it is a specialty oncology program and a specialty oncology pharmacy, not a pharmaceutical company, a pharmacy company. And Alan is going to explain what that means and all the different services that they offer our patients. We already work with patients that have tapped into their services, and I have to say that they are all very pleased with what Haven has been able to serve them with and assist them with. There's some really great programs and services that they do, and I think it will be enlightening. Now, I'm just going to qualify this evening, and in no way do I mean to take away from Centrix and Haven and the wonderful work they do, but I just want people to be aware that there are other pharmacy companies out there, and maybe a different one might be suitable for you, but mostly I want you to understand what they are, what's available through them for you, and how they can help you. And I mean help you. So I'm excited to learn because I don't know a lot about this. So Alan, I'm just gonna, if you don't mind, read a really quick bio because I think people should know who you are. And you are the Associate Director of Provider Solutions Oncology at Centrix Health. You've had 13 years experience working in cancer care, so you're well versed in what's needed. And Alan is also a former drug access navigator at North York General Hospital in Toronto. He was also the founder of Drug Access Canada at drugaccess.ca. And in 2021, Alan joined Centrix Health, where he manages the Haven Oncology Patient Support Program. So we're very excited to have you here this evening, and we're ready to be enlightened and find out what this is all about. So I'll let you take it away, and I think you're all set with your slides too, right?
Yeah, can you see everything?
I can see introducing specialty oncology programs.
Awesome.
So I
Perfect.
think we're set, and I'm going to leave you to it.
Thanks,
Thanks.
Christine.
Bye-bye.
Welcome, everybody. I'm taking the time this evening to learn about oncology programs and specialty pharmacy. First, I want to thank Kidney Cancer Canada, Christine and Mona, and the whole team for this opportunity to provide some education on this topic of patient support programs and specialty pharmacies in oncology to create some awareness that these programs are out there and available to help patients. So Christine did my bio, but I just wanted to put a picture up there. So this is me with my dog, Luna. I have been working in oncology for 13 years now. 9 years was spent at North York General Hospital. Before that, I was at Princess Margaret Hospital, also in Toronto. So I've been in the oncology space for a while, and I've supported hundreds and hundreds of patients, I would say, over the years. So the first thing I want to cover is just to make sure we're all on the same page when it comes to what specialty pharmacies are. So everyone is probably very familiar with their community pharmacy. There's a lot of people that say the most reachable healthcare provider for most people is their pharmacist. There are pharmacies all over the place on many street corners. You'll be able to find a Rexall or a Shoppers Drug Mart, all sorts of different community pharmacies. The difference with a specialty pharmacy is that they focus on more complicated or rare or hard to treat disorders, things like oncology or for cancer care. The people at specialty pharmacies typically have additional training or expertise in these areas. And it's because they see these products, these specialty drugs. There's no specific definition of what a specialty drug is, but it's usually something that is maybe more hazardous or complicated. Sometimes it just means the cost. And if you're familiar, a lot of cancer drugs can be very, very expensive. So specialty drugs are typically managed by specialty pharmacies. Uh, there could be special handling required for some of these drugs as well. And we know in oncology, some drugs need to be manipulated or they're very toxic to handle. And they might need special equipment or rooms to manage them that a typical pharmacy might not have. And these trained pharmacists that work in specialty pharmacies, which we'll talk much more about, are people who will be supporting these diseases, like someone with cystic fibrosis or multiple sclerosis, all day long. So this is not a pharmacist who might see the occasional cancer patient. It's someone who only deals with cancer all day, every day. And you end up really understanding a lot more about what patients go through for these drugs, what it's like to take these medications. So that's really where the specialty in specialty pharmacy comes from. It's from just this routine, regular interaction with people with higher touch point diseases or drugs that are used to treat these complicated disorders. And you may very well, if you are a patient with cancer or with kidney cancer, you might have been enrolled into a patient support program. And these are programs that are typically run by specialty pharmacies, and they provide services that are very different depending on the drug and depending on the type of cancer or the condition. But their function is really to provide services that fill gaps that are left by a public or a private insurance. So something like providing financial assistance. If you have a medication and your private drug plan is covering the drug at 80%, you might have a 20% copay. Patient support program might be able to cover that remaining 20%. They can also provide free drug. So sometimes you might need a month or two of free drug while you're waiting for maybe your insurance to say yes to covering your medication. They also sometimes will provide compassionate drug, which means free drug until further notice. So that could be on free drug for years. And there's certain criteria that would need to be met to access that, but these are the types of things. If you've ever been enrolled into a patient support program, you might have gotten some of these services or spoken to some of their staff, some of the nurses that they provide support with, who can do counseling and follow-up calls to make sure that you're doing well on your new drug. So these are all kind of tied together where specialty pharmacies provide patient support programs to do these services. So next, I'm going to talk a little bit about Centrex, which is one of the specialty pharmacies that are available in Canada. And as Christine mentioned, there are others. You might be enrolled into a patient support program that's run by Centrex, or some of the others like McKesson, Bayshore, Innomar. There's many different specialty pharmacies that are across Canada now. So some of the things that we sometimes hear is, why would I use a specialty pharmacy versus my community pharmacy? I have a very good relationship with my community pharmacist. They fill my medication and everything's fine. And that's true for a lot of patients. They might have used their local pharmacy for a very long time. They get their medication there and it's all good. So this slide is really just to go over how they're different. But it's not to say that one is better than the other. They just have different focuses. So the way, if you're going to take away anything from this slide, the way I see it is a community pharmacist is doing very general tasks. So they have to be able to treat patients with everything. Doesn't matter what comes through the door. There might be medications that are for hypertension and birth control medication, and then just on and on. They have to be able to respond and support patients with anything that might come through the door. Where a specialty pharmacy, The main difference is if you're going to speak to a specialty pharmacist who deals with cancer, then that's all they deal with. If you have concerns about something else, like if you also have diabetes or another disorder, then you would be expected to speak to somebody else about those because a specialist in a specialty pharmacy is really just geared towards the primary reason that you are enrolled or put in contact with this person. There's some other key differences too that specialty pharmacies typically provide. They might have drug navigators, so people who can help with reimbursement investigation for drugs to see if they can be covered and help navigate that space. And that can be very complicated as well. Typically, a community pharmacy is not going to have specialized staff to help with drug coverage. Specialty pharmacies also typically will, as I mentioned, like do follow-up calls, maybe on a monthly basis or periodically check in to make sure that after you start on a new drug, have you had any side effects? Now that you've been on the medication for 2 months, are things going well? Anything to report back? Similar sort of check-ins that you might get from your hospital care team. But typically a community pharmacy, once you fill your medication with them, they kind of leave you alone after that. So they might be available if you have questions. You can go back to the pharmacy and ask, but not proactively asking you, are you doing okay? So there are some key differences. But again, specialty pharmacy and community pharmacies, they both have a place. They're both very important. And it's not that one is better than the other. It's just they have very different focuses. So this is what Centric's pharmacy looks like. They have locations across Canada. You can see the different locations spread around, but there's only a few different pharmacies. So because it is a specialized pharmacy, there's one in each province, as opposed to a chain pharmacy, like a community pharmacy, where you might have many, many locations, hundreds of locations across Canada. So that's really another one of the main differences. One of the things that we have with some of our pharmacies at Centrex is our own drivers. So they can provide delivery of medications to patients, which is especially useful if they're more remote or have challenges getting to their hospital. Maybe they live several hours away from their hospital. Things like in Northern Ontario, for example. Centrex provides free shipping of all the medications that we support, that a company like Centrex, a specialty pharmacy, will provide that maybe are more less common, I should say, in the community. So because Centrex is a specialized pharmacy and focuses on specific conditions like cancer, it is the way the company's been built. It's built around supporting patients who have cancer and come from hospital, for example. So we make sure that we emphasize a very smooth transition for a patient who's in hospital being treated by the care team, and then having them transferred over to our team. You might not get something like that outside of a specialized pharmacy. So our team will reach out to your hospital, speak to your pharmacist, speak to the team, ask them any questions, and try to make sure that they're not asking you all of the questions instead. So then when our team talks to you, we've already been informed of everything. We've seen the clinic notes from your oncologist, we've seen your blood work and your lab results, and we're as close as possible informed as your hospital team as well. The team here at Centrex as well, they use a lot of the same side effect management materials, drug counseling materials and tools that are used in hospital. So we try to make sure that the way things are being communicated and taught in hospital is the same way that our team uses them, using the same content, for example. So there's no contradiction that way between what you might be told at your pharmacy versus what the hospital told you. We want to make sure that we're on the same page, and it's, again, a very smooth, seamless handoff because we're replicating a lot of the same things we do in hospital. A lot of the team here also has the same training as staff do in hospital. So nurses, for example, who work in a cancer clinic will have to be D'Souza certified. If you're a nurse on the line, you'll know what that means. But our teams at Centrex, our nurses are also D'Souza certified. So they have gone through the same training certification that a nurse in a hospital would. So it's a way of making sure that our specialized team are actually specialized. They have the extra training that the hospital team would have when supporting cancer drugs and cancer patients. So this is one of the drugs that is used for kidney cancer. It's called Lenvima or lenvatinib. The patient support program for this drug is run by Centrex. So if you're on Lenvima, if you've been enrolled into the AZI Cares program and spoken to any of the nurses or case managers on that program, then you have already worked with a specialty pharmacy. You've already had interactions then with Centrex. So this is just one example. Basically, almost every drug in oncology has a patient support program. AZI Cares is the program for Lenvima, but there are probably maybe 200 different drugs in cancer care, and almost all of them have their own specialized program like this that provides, again, a lot of these different services with financial assistance and nursing support. So Haven is the program that I manage at Centrex. It's like AZI Cares and a lot of the other patient support programs that are out there. But because I worked in hospital before joining Centrex, and I had this opportunity to create my own patient support program, I wanted to use a lot of the experience that I've had in oncology over the years to create something that was a little bit different. So these are the team members that we have on Haven. So we have two pharmacists that come from hospital oncology cancer clinics and a drug access navigator. So Brenda, Allison, and David. They all have worked before they joined Centrex, like myself, all worked at hospital cancer centers as well. So I think between us, we have a few decades worth of working in hospital cancer centers and helped many patients over the years. So I mentioned that the AZI Cares program focuses on the drug Lenvima, and that's typically how patient support programs work. Each program supports maybe one drug or a few. It will depend on the manufacturer. So AZI is the manufacturer of the drug Lenvima. So their support program is only for their own drug. And unfortunately, that creates a lot of patient support programs. So there's probably at least 100 different patient support programs across oncology. So that's for kidney cancer, lung cancer, breast cancer, for everything. So there will be a program for Sutent, a program for Votrient, a program for Cabometyx, a program for Toracel, a program for Wyost, many, many programs. And as a patient, you might be on one of these drugs or more than one of these drugs at the same time. With Haven, instead of having to deal with multiple programs, you just have to deal with the one program. So Haven is like a one-stop shop where we consolidate the supports for all of these different drugs, and you can get support for them by just talking with one team. So if you are on, for example, maybe you're on Sutent and Wyost, so denosumab, instead of having to coordinate with the two programs, Haven would coordinate with them, and you only have to speak with one team. So it's a way of making it a little bit easier on you, which is less phone calls and less people to deal with when you're trying to sort out these medications. It means that the drugs are being discussed and sorted out at the same time. So if you're speaking to one of our pharmacists, you don't have to be told about one drug and then someone else tells you about the other drug. They tell you about all of your medications at the same time, like you would be told in hospital. And you might have gone to your hospital pharmacy and they might have told you about all your drugs at the same time. And you're like, this is the experience I already got when I was at Princess Margaret Hospital or Sunnybrook Hospital. And that's true. Haven is not for necessarily for people who are at a very large cancer center where they have many people there to help you, but there are a lot of patients who are at smaller hospitals, hospitals that don't have pharmacies, patients who are maybe more remote as well. and are maybe not as easy to access a lot of these services that are different. If you're in like downtown Vancouver and downtown Toronto, you have a much easier time accessing services and people. But Haven is really intended to fill the gap for patients who had a really tough time getting support for everolimus or don't get any support for their pazopanib and maybe are paying out of pocket for some of their copays or deductibles. Our intent with Haven is really to put all of this together and help as many patients as we can, as Christine mentioned. So we definitely have already helped some patients with things like everolimus. We have many patients on pazopanib. Happy to help with any of these as well, if there's questions after the presentation. So again, our team is really about taking, instead of 9, 10 different patient support programs for all of these different drugs for kidney cancer, you just need to be enrolled into Haven. So for your healthcare team, for your doctor or for the nurses you work with in the hospital, it's also easier for them. They only have to have one fax number for us, one email, one phone number to call. They're working with the same team across all of these different medications. So it's really about reducing the workload on your team as well. That's one of our key focuses because when we save an hour a day, for example, for your hospital's cancer clinic, it means that they can spend that hour with more patients or more time with you when you want to talk to them. So instead of scrambling in the hospital, one person to the next, just trying to get as much done as they can, if we can take off some of that workload and make it a little bit easier on them, then they can spend more time with you. So some of the things that we provide on Haven, but a lot of patient support programs, again, we're not the only one out there that provides support for cancer drugs, but they very often will have somebody like a drug access navigator. You might have spoken to a drug access navigator in your hospital. A lot of hospitals do have one, but not all the time. They also have different names. They might be called a medication reimbursement specialist, drug access facilitator, all sorts of different titles. But these are the key things that they do, and Haven has one as well. So they can help you explore financial assistance, get you that bridging drug if there's compassionate drug available for your medication, to help you access those too. A lot of these things are not publicly knowledge, like they're not online. So it's really only accessible if you know where to go and who to ask and the right forms to use. But our team, because we've spent so much time dealing with these things, we have all of these resources available to help patients right away. One of the things that can really slow down getting a medication, if you've been through this, is there's a lot of paperwork with private insurance. It can also take a long time for them to review the drug and the paperwork to see if you're going to get coverage or not. So our drug access navigator can help you with those forms, call your insurance on a regular basis, see if things are going through, when's the request going to be approved, and take all of that off your plate. So then you're not spending time on hold, checking in to see if your request has been processed or not. They also can help with applying for public drug coverage. And so in some provinces, it's automatic if you have a public health card. In some provinces, you have to apply for different public programs available through the province. So just like private insurance, our team can help you fill out the forms, following up to make sure that you're approved, as quick as possible for programs like Trillium in Ontario. And then sometimes you might have your hospital, your doctor might submit a request for a drug to your public or private insurance, and they might say no, they might reject that. So we also support your hospital or your physician with appeals. So sometimes we can overturn the rejection by providing additional evidence or information. We try to make sure that if there is a rejection, we've done our best to overturn that and see if we can get it approved. We also provide these kits. So these are starter kits for patients who are using Haven. Again, a lot of patient support programs also provide their own sorts of kits, various things in the kits. Ours have a brochure, a notebook and pen, a magnet with our contact information. So really just some small freebies just to get you started on your medication. And some drugs, if you're on pazopanib or Votrient or sunitinib, the brand name Sutent, these drugs can cause hypertension. So we also provide a free blood pressure monitor if you are on those drugs, because a lot of patients might not have a blood pressure monitor. And we have a very strong focus on patient safety. So we want to make sure that if you are on a drug that can cause hypertension, that you are given a blood pressure monitor, taught how to use it, and then recording your outcomes to make sure that everything is going through safely. And again, other programs out there will provide kits usually. They might have different things in those kits, but it is something that another reason, to use these patient support programs, they might send you something. So these are the more basic things that patient support programs provide, but there's also specialized clinical services that are also very useful, and their focus is really to make sure that you're very safe when you're taking these drugs. If you are on any of these kidney cancer medications, you know that they can have a lot of side effects. So it's really important to make sure that you're being monitored appropriately so that we make sure that we can catch any side effects early, if there are anything. That's why we have our oncology pharmacists. So I mentioned this earlier, specialty pharmacies often will have these oncology pharmacists. So these are pharmacists, but they have had a lot more time and experience with cancer drugs with cancer patients. So our team, for example, on Haven, can provide medication counseling. You might say, well, I already received medication counseling at the hospital. I don't need that again. But we know from our own experience that often you might be getting counseling in the hospital and it's not the best time. It can be very overwhelming and very scary, and you're getting a lot of information. So when our team will reach out to you, it might be considered counseling, but if you only remember half of what was told the first time and we're repeating it to you, we're hoping you'll remember the other half. So it's a way of just reinforcing things. So you get told the same thing maybe again, but you're picking up new details. It's like watching a movie twice. Things that you didn't notice the first time. Okay, now I know to do that, or I didn't realize to do that with the medication. So it's again really reinforcing things to make sure that everything is safe. Our team will also contact your community pharmacy if you're on other medications, and they'll do a drug-drug interaction check. So a lot of cancer drugs, as we talked about, have many different side effects, but they can also interact in a lot of different ways with other routine drugs that you might be on for all sorts of different conditions. So when we detect something like a drug-drug interaction, our team will reach back out to your prescriber, so your medical oncologist, and explain that there was a drug-drug interaction detected between this new drug, sunitinib, and something else you're taking. What do you want to do with that? Is it that the drug should be changing the dose? Do we need to choose a different drug for you? Different sorts of outcomes. But again, it's really to make sure that you're not going to have a negative experience on this new medication. Our team, our pharmacists, will also look up your chart notes, all the different documentation that your medical oncologist has dictated and written out, reviewing all of that to make sure that we are aware of your treatment plan. We know what the intent is on starting this drug, when you're starting the drug, and also access to things like your blood work. So your hospital might be checking your blood work, but it also is very helpful to have another set of eyes making sure that everything is going well as you take your medication, and that there's no surprises. If we do see things in your lab work, then we can reach back out to your hospital and your care team and say, this value is dropped, or this is very high, just to make sure that they're aware. So our team is always kind of around just to make sure that things are going safe and you just get another pair of eyes to watch out for you. And as I mentioned at the beginning too, our team will follow up. So after you start on a new medication, they'll call you usually 8 to 10 days later and see how are things going. Is it as you expected? Have you had any of the side effects that we talked about? Anything you want to ask now that you've been taking the drug for a week? Anything come to mind? So we want to make sure that we're checking in and you're not like feeling alone or that no one's there for you. Sometimes hospitals will do these proactive check-ins, but not very often. So we want to make sure that if there is anything, now you've been taking this drug for a week, if there is a side effect, something unexpected is happening, that we can talk about that. Maybe we can resolve the side effect and make sure that your primary team, the hospital, is aware. Our team will also make these treatment calendars if you ever need one. A lot of pharmacies can do them if you ask. You might not be aware that they're available, but they can write out your different medications if you're on multiple drugs, when to take them per day. And this can be especially useful if you're on a drug that's not taken every day. There's a lot of different cancer drugs where you might take it for 2 weeks on and then a week off, or 3 weeks on and 2 weeks off, and all sorts of different combinations. And it can be easy to accidentally keep taking the medication, even though you were supposed to stop after 14 days, for example. So a calendar can be a nice way of having it all written out for you and just cross out each day to make sure you've taken those medications. And then when there's nothing on that particular day, don't take your medication. And if you are not a patient, but maybe a caregiver, this is something that can be really helpful, maybe for a parent or another loved one, that they are taking their drug as intended. Our Haven team and our Centrex pharmacy can also blister pack medication. So this is similar to the calendars. It's a way of making sure that if you're supposed to take 2, 3, 4 medications at 8 a.m. Every morning, which ones? It can be easy to get mixed up. Do I take this in the morning or in the evening, or is this the 2 in the morning, 1 in the evening? It can be easy to get those very mixed up, right? So blister packing is another thing that specialty pharmacies often provide. It's something that you might be able to get in a community pharmacy. They might charge you like a fee for that or something, but it's another way of just making sure that you're taking your medication as intended, and that there's no mistakes, nothing missed. So again, you might be saying, well, I get a lot of this at the hospital, and I don't really need any of these services. And I'm really happy for you that you're getting a lot of support in your hospital. But again, it's not the case that everyone has that experience. And there's, again, a lot of hospitals that they don't have their own pharmacies, or people who might be 3 hours away from their hospital pharmacy. They can't get there easily. It's not something that they can just pop over to, a 10-minute drive away. So something like Haven is intended for filling those gaps. So again, our team is really about one team, right? It's especially useful if you have metastatic disease. You know that you might go from maybe you're on Lenvima and Keytruda or pembrolizumab, and then you might go on another medication after that, and then another medication after that. That could mean that you're dealing with a different group of people for each drug, a different patient support program. With Haven, at least, if you were to use our model, you can enroll for one drug, and then if it loses effectiveness and you need to go on to another drug, you might be able to continue with our team and get that new drug, but with the same people, the same oncology pharmacist who will be with you, and the same drug access navigators. So as you move from drug to drug, it means that you're not going to be uprooted and have to learn a new team, a new delivery driver, a new pharmacy. You can just stay with one through your whole journey. So it's about making that consistency, instead of having to relearn everything with each group. And if anyone needs to access the Haven information or the other patient support programs, They are on the Kidney Cancer Canada website. So there is a section for patient assistance programs for MRCC. Haven is in that index, as well as many of the other different patient support programs out there. Our intention is always, if you are on any of these kidney cancer take-home drugs, and you need financial assistance or you need support with them, you can use Haven or any of the other programs to make sure that you're getting supported. We would love you to use Haven, but there are other programs available as well. So the most important thing is that you know this resource is on the website, and that the contact information of the different patient support programs is all listed. So if you would benefit, or if you know someone who would benefit from support, definitely check that out. And the better, or the sooner you can get into these programs, the better to help you. So just in summary, our intention with building Haven is all about creating this one team experience. So whether you're on one drug, you're on 2 or 3 different drugs for your cancer, as you saw with Lenvima, it's often given with a drug like everolimus or with pembrolizumab. It's very common to be on more than one drug from your care team. With Haven, it's about getting all of those drugs together, not having to go to multiple pharmacies or dealing with multiple teams of people. It's about just getting it all as one, treating you as one whole person. We have hospital oncology pharmacists who are there throughout your journey, making sure that your medication is being taken safely, and that your lab work is good, and they're in regular contact with your hospital care team as well. So you might have your hospital oncology pharmacist and then your Haven oncology pharmacist working together to make sure that you're taking your medication safely and that you're doing well. We also want to make sure that you're taking your drug as quickly as possible. That's one of the other key focuses of our Centrix pharmacy. We always have your drugs in stock, and it's about getting your drug as quickly as possible out to you, so you're not waiting a week or more for your medication. If you go to a community pharmacy, they might not have these drugs that you've been prescribed on hand, and it's not their fault. They don't see a lot of kidney cancer patients. But as a specialized pharmacy, it's something that we always keep in stock. And then our drug access navigators. So these are people who spend all day going through insurance and forms and different tricks and tips to get your drug covered, making sure you're paying as little as possible or nothing for your drug. And they know who to contact and how to do things to get these medications covered, or at least accessible as quickly as possible, so that you don't have to worry about those and figure out how to navigate the healthcare system. So I have just one last bit. This is a comment that we get. This is a recent testimonial that we got from a patient. We actually get quite a few comments like this on Haven, which I think is the best thing in the world. I think the testimonials are the best part of running a patient support program. But this particular person was saying that it's very overwhelming when they were being provided education on their new drug. They got to see their oncologist, but it was all very urgent, and it's overwhelming being in the hospital and learning all these things and meeting all these people. But by talking with our Haven Oncology pharmacist, they were able to go through things calmly. They were at home and they were explaining how to take their medication, what to look out for with their blood pressure monitor, and how to take their drugs safely. So even though, again, it seems like maybe it's replicating some of the things you got in hospital, you're getting it replicated in a much calmer place. Especially when it's somebody calling you on the phone, you're at home, you can relax, you can put them on speakerphone, you can have your family around all asking questions together. So it's not to take away what they do in hospital. That's very important too. But there is definitely a benefit in having things reinforced and understanding in more depth and more detail how to take your drug, what to look out for, how to use a blood pressure monitor. That is
Well,
all I have, Christine.
that was a lot, and it was great. Thank you. And I really appreciate, Alan, that you presented in such patient-friendly language. It's sometimes when we're in a webinar and we're trying to absorb all the information, I really appreciated how you presented. And it makes me kind of feel this is the way that you and your team connect with patients when they sign up for your service. It's calm, it's well explained, easy to ask questions. I see we have some questions in the chat, and I've jotted a few down myself. So,
No, I think you're right. Like our
yeah,
team will spend an hour explaining your medication. It's
yeah,
if you need an hour, we'll spend an hour with you. It's
yeah.
about making sure that you're comfortable. We'll go at your pace. There's no rushing. We want to make sure you're okay.
That sounds great. Now, you gave me two great segues. Number one, I'm going to ask our audience, our listening audience, if you have any questions for Alan or for us, please type them into the Q&A. Alan is going to answer them in just a second, or the chat, either one, whatever is easier for you. But it was a great segue with your testimonial at the end, because I've invited one of our patients, Wendy, who is I guess, a connection to Centric, already has a connection to Centric. Wendy, would you mind joining us for a minute, please? And I just wanted to make sure that everybody can see Wendy. So maybe if we're done, that's great.
Yeah.
Thank you. So Wendy, I invited you because you're a longtime patient supporter of Kidney Cancer Canada. We so appreciate it. And you're one of our peer support volunteers. So, and I know you have a connection with Centric, so maybe you can tell us a little bit about your experience.
Yeah, so I live in Eastern Canada, in Cape Breton, actually, in Nova Scotia. And I've been stage 4 kidney cancer now for 10 and a half years. I'm on my 5th line of treatment. And the first 4 I was able to get at my local pharmacy. Well, one was immunotherapy, so that was at the hospital. But then 2.5 years ago, I started with Lenvima and everolimus, 2 of the ones that Alan talked about there earlier. And we could not get the Lenvima here where I live. So the oncologist or someone at the hospital set it up with Centrex out of Halifax, which is 4 hours from here. So for the last 2.5 years, I've been getting my Lenvima from Centrex, and they've been wonderful. I've learned a lot from Alan today, though, because I really didn't understand. I just knew it was a specialty drugstore in Halifax. I'd been there a couple of times to pick up the medication when I'm traveling, but it's usually delivered to me, and they've been excellent. They call every month and they ask, great questions. In fact, I got a call this morning while I was at the grocery store. It's time for your refill, and how are you doing? And in fact, I was sick for the last 3 weeks, so we stopped the Lenvima and the everolimus on the 13th of January. So, I was able to explain that, and she said, okay, I see the oncologist next week. Well, we'll call you back the next day, and we'll talk about what's the next plan, if you're ready for your refill. They're just great. And then in the fall, I had a hard time getting the everolimus, which up till then I was able to get it locally, and then just went in once to pick it up, and they said, no, I'm sorry, Wendy, we can't get it. And as Alan would probably attest, it was hard to get. So I didn't panic because I knew Centrex existed. Normally I would call the oncologist and panic, but I didn't even do that. I just called Centrex and said, here's what's happening. And Chris said, leave it with me and I'll see what I can do. And by that afternoon, he called back and we got some in Ontario for you. We'll have it to you, 3 or 4 days, whatever long it took to get here. And it was quite a relief because, that happened to me, a few years ago. I would have panicked. What do you mean I can't get my medication? But it's great. They call you every month. I didn't realize I didn't know about Haven, so I am interested in that. But maybe that was part of why they looked for the everolimus for me. I don't know if
Yeah. So it was the Haven team that helped track down that everolimus.
Oh, okay. He would have
Yeah,
contacted.
we work together.
Oh, there you go. So you know my people. Yeah, no. So I really appreciate Centrex, and now that I know about Haven, I'll be inquiring more about that. So, and like I said, I'm on my 5th line, so I've had lots of experience, and we don't know where we're going after this. So it's nice to know that places like Haven exist for that, for sure.
Yeah.
Thank you.
Wendy, you brought up a really good point, and it's one of my questions. And please stay with us, Wendy. And maybe Mona, you would like to join us now. Mona is our communications person, and she's also our French Canadian connection, our French speaking population. So If you have questions in French, please feel free to put them in the chat and Mona will look after you for sure. I think this is a great service for people in remote and rural areas, because we don't always have access to our local pharmacy. And Alan, please correct me if I'm wrong, but my understanding, and this is something I learned early, is pharmacies, like your in-person pharmacies, are somewhat limited in the very expensive drugs, like cancer drugs, that they can keep in stock. So often you may go to fill your prescription, but it may be a period of time before they can actually bring it in just because of A, the cost, and B, availability, where you
Yes.
don't have that difficulty, right?
Yes, so that's one of the key benefits of using a specialty pharmacy. So
Mhm.
when I was at North York General, we would have sometimes a patient would take their prescription to their local pharmacy, thinking everything would be fine. And then the local pharmacy would say, "I'm not bringing this in. It's $12,000."
Mhm.
I can't risk that because you might not get it from me, right? I might order it for you and then you leave. I'm at a huge risk if that could happen. Not that I don't trust you, but it's a
Mhm.
huge risk for the pharmacy to take. A lot of pharmacies, they're small businesses, right? Like not
Yeah.
all of them are a Shoppers Drug Mart. Some of them can be much smaller,
Mhm.
and it is a lot of risk and a lot of potential problems for them to do that. So it's kind of understandable that they don't want to order it in. They would
Yeah.
rather you go somewhere else and get it.
Yeah.
Those are drugs that we deal with all day long at Centrex. We have many, many things like that on the shelf, cost a lot of money. So it's not a burden on the local pharmacies to have to order that or be expected to. Some will
Right.
order it, of course. And Wendy, you got your medication locally, so it does happen. But if you are a patient who doesn't know, am I going to get it or not? At least you know if you go to a specialty pharmacy for sure, you'll be able to get it quickly.
Yeah. Yeah, that was great, Wendy, that you were able to get the everolimus so quickly because that is a drug. And Alan, you and I have had conversations before. Everolimus is a difficult drug to access in places across Canada. So anyone that we've kind of sent your direction, you've been very helpful, and we so appreciate what you've been able to do for our patients. Um, I see Valerie asked an important question, and it was one of my questions too. Are A, the medications used to treat side effects, such as maybe, a specialized mouthwash or, hand and foot cream or something like that? Do you look after that as well, or is that a separate situation?
So we try our best to also fill the supportive medications that are for side effects.
Mm-hmm.
I can't say it's 100% always going to be something that we have, or there are times where it's better to get it from your local pharmacy. There have been patients that we've actually referred out of Centrex because for various reasons, it's actually better if you use your local pharmacy instead. So it's
Okay.
always what's best for the patient. If we can fill it for you, and we have it and it's fastest to get it from us and cheapest to get it from us, then we'll do it.
Okay.
If it's not, for whatever reason, like the mucositis mouthwash for the
Mm-hmm.
everolimus, if it's better to get somewhere else, then we'll tell you that.
Well, that's appreciated. And Valerie also wondered, would these say that you have coverage? Would these side effect managing drugs be covered through you?
Sometimes. So
Okay, that's
yeah,
fair.
I guess the problem with the whole medication world is everything is maybe. So
Hmm.
it depends who's paying for your drug. You might have a private drug plan that's covering your Inlyta or the
Hmm.
everolimus, who also covers your supportive medications, or you've been prescribed a supportive medication that's covered, but another one that's not. You might be covered by the province and the province covers it, or the province doesn't cover that particular drug. There's all sorts of variables, and even sometimes they'll cover one brand but not another. So it goes back to that. It's only with experience that you would know, I see you were prescribed this medication, it's not covered, but this other one that does the same thing is, I'm going to call your doctor and have them switch it and then you won't pay anything. And that's something that you might not get from a local pharmacy who's never seen the drug before. And
Right.
again, no offense to them, it's not their fault, but it's because we deal with a very specialized subset of drugs. We
Mhm.
know those types of tricks. This is not the right drug. This one will be covered. We'll save you $40, situations like
Okay.
that.
No, that's perfect. Thank you. I have a question. Do you need to be referred by an oncologist or a urologist? And
No, so yeah. So a lot of patient support programs, they do require enrollment or involvement of your physician. When I put Haven together, I wanted to make sure that a patient could self-enroll. So as long as you have our phone number, our email, you can just call us and just say, this is my situation. I'm paying $400 a month for my pazopanib. Is there anything you can do? And then we will look into it and help you out. So
okay.
we will tell your treating hospital that you've been enrolled in and we're supporting you. We want to make sure that we're working together with them, but they
Hmm.
don't have to enroll you. So it's another way of making it easier on your doctor. They don't have to
Hmm.
fill out more forms to use Haven if they don't want to. You can just call us.
So that makes it easier for the patient as well,
Yeah,
because they
easier for
don't have to
everyone.
go through the process of getting in touch with the office, getting in touch with the doctor. Wendy, did you get direct access? You have your hand up and sorry, you're on mute. Just want to make sure. Yeah.
I had my hand up, but it was the oncologist. They couldn't find a drugstore to do the Lenvima, I guess. They just said we're going to get it through Centrex, a company in Halifax. I I didn't understand at the time anything other than that the local drugstore couldn't get it. I didn't realize it was a specialty pharmacy or anything. I just kind of learned that afterwards. So, but it's good to know that you just can call or email. Like where I already deal with Centrex, can I ask now to be part of Haven, or does my Centrex just do that? I wonder. I don't know.
Yeah, we've had that happen. We've had patients use our pharmacy, and similar to your situation, Wendy, they've had an issue with a drug. And then the pharmacy will say, call this number. This is the Haven phone number, or I can just transfer you over, or I'll make sure you get in touch with these other people who can help you with that drug. So we do work as like a closed circle.
Oh, okay. Well, that's good to know because
Yeah.
when you just mentioned about, for example, mucositis for mouthwash for everolimus, like no one's ever talked to me about everolimus, and there's something I could get for the mouth for that. So those are the kind of things that would be great to have, like because
Yeah.
the doctor doesn't know, and the oncologist they can only know so much. So that's great.
Yeah. Yeah. We know that all the little tricks out there.
We'll be getting
Donna,
touch.
do you have another question by any chance?
Well, I had a question. So can somebody be at the oncology pharmacy at the cancer center, but still tap into the Haven patient support program? Or it has to be given from Centrex and then you can get Haven? Like, how does it work?
Yeah, yeah. So
Mm.
the way that we pay for everyone is by dispensing the medication. So we do need to also dispense the drug too. There is that little caveat as well. But that's how we, like a pharmacy,
Mhm.
to keep the lights on, to pay for everyone's staffing and everything. It's from dispensing the drugs from our pharmacy that we can afford to provide these services. So there is an expectation to use our pharmacy.
Good. That's fair. I mean,
Yeah.
you need to be covered too, right?
Yeah.
Yeah.
I wish there was another way, but yeah, that's
Yeah.
kind of the
No,
trade-off.
it's great. I have another question. How do you, and maybe you answered this and I missed it, but how do you get the drugs or the treatments to remote and rural areas in a timely fashion? Is it?
Yeah, well, there are different companies out there that can provide these services. We also have our own fleet of drivers, so it will depend on the situation. We might use our own Centrex driver.
Mhm.
It might be just Canada Post even sometimes, depending on how urgently it's needed. But there are, we might have learned during the Canada Post strike, there
Yeah.
are lots of little couriers out there that can
Yes.
provide rapid service like that. So. It depends how urgently it's needed. Like, is it due today or is it due in 2 days? And that will determine who we use.
Okay. Okay. But it's usually pretty timely then.
Yeah, as quick as we can. We know, like especially our team, we've dealt with so many cancer patients. You want to be on drug yesterday, right? We don't want to make you wait
Yep.
any more than you absolutely have to. So we will move heaven and earth to make sure we can get you that drug if we can.
Thank you. And I really appreciate too that you work hard to get drugs that are not readily available in each province. I mean, we've come up against challenges a few times and you've been there to help. I'm not going to say that you're going to guarantee doing that because
Yes.
I know there's real challenges, but like Kidney Cancer Canada, we try hard to answer your questions or find information. I know you try hard to do what you can for the situation. So that's much appreciated. Mona, do we have any more questions in the chat?
Well, there is one that is, how does Center exports with the BC Cancer Agency pharmacies?
So in BC, typically the BC Cancer Pharmacies will handle anything that's publicly covered, so anything that the province covers. We do support patients in BC where they don't meet the provincial criteria.
Mm.
So I'm actually working on another presentation on this topic. So you might have a drug that is covered by the province, like everolimus or pazopanib or sunitinib, but you have to meet eligibility criteria for it to be covered. So it might have to be used in the second line, or you can't have gotten this drug first. There's all sorts of different rules for the
Yeah.
different drugs. So BC Cancer has their own list of criteria. And if you meet the criteria, the BC Cancer Pharmacy gives you that drug. If you don't meet the criteria, that's where we support. So you might have a patient who lives in Vancouver, has a private drug plan through their employer, and prescribed a drug outside of the criteria. Then we can help you with that. We might be able to get approval, financial assistance. We'll help you navigate to see if your alternative drug plan or even maybe paying out of pocket. I'm always surprised when patients pay out of pocket for their drug.
Mhm.
You don't know what people are capable of. So, in those situations, how can we get you the drug for cheaper, right? So we
Right.
try to help you depending on the situation, and it varies by province to province. We don't really, there's not a lot of need in BC for these support programs. It's more Ontario and Atlantic, like with Wendy.
Mhm. Right. And I think that's a really important point that you just brought up. There are drugs that may not necessarily be covered, and you may make the choice, the patient may make the choice to try and fund that on their own. But it's wonderful that you work with them to try and find some way to make it a little easier on the pocketbook for that purchasing that drug, because
Yeah,
they
and
are also very expensive.
they are. Even with the discount, it can be expensive,
It
but
can be, yeah,
um,
quite
we,
prohibitive, but
we've seen patients who, like sometimes there's misinformation as well. Like they were
mhm,
told that their drug wasn't covered, and then we look and it is, and they're quite surprised. Like they thought it was something they were going to have to pay fully out of pocket for, and there was a program all along to support them, and they're either paying nothing for it or very little, but no one connected them with that program. It was just missed.
mhm,
So again, because we have this experience with these drugs on a regular basis, if
mhm.
there is any mechanism to get you support, we'll know it or connect you with that program.
Okay. You know what? I think that's something we missed to share, and maybe it was kind of intimated, but there's no charge for you to do this. Is that correct?
Yeah, that's the other thing. Yeah, my job at North York General was to make sure that patients didn't pay for medication.
Hmm.
And I would feel so bad if I had people pay any money for our service. So everything we do, there's no expense. It's purely out of the dispensing of these drugs from our pharmacy. So there's never any fee for our team asking questions, any of the services. It's really, we want to make sure we save you as much as we can.
Hmm. I think that, thank you. I don't
Mhm.
know that we really made that clear, and I think that's a very important point. And that also lends to the answer that you do need to dispense the drugs because you do need to get paid, and you're not charging our patients. So it's key that it's a complete service. So I think
Yeah.
that's pretty, well understood that by our patient community. We do have a question, and we don't usually entertain, for many reasons, personal situations, but I'm going to try and trim this one down a little bit, even though it's in the chat. So, first line of treatment, they overlooked everolimus and lenvatinib, and please correct me if I'm wrong. They went to Inlata and Keytruda, so that it would be second line availability. I think you can see it, right, Alan?
Yeah. Yeah.
Okay. So maybe you can answer that question in generically, sort of.
So situations like that are hard to answer here. Like typically we
Yes.
say you'd have to be enrolled into the program, and then we can ask you a whole bunch of questions and see
Right.
what's been tried. There's so many variables, unfortunately, like where you live, the hospital you're treated at, the province
Mhm.
you're at, if you have a private drug plan. There's so many variables, so it's very rarely very black and white.
Mhm.
There might be an option, or there might be a way of getting the drug for cheaper. And
Mhm.
so, everything is accessible. Every drug is available if you're willing to pay for it, right? So
Mhm.
it depends how cheap we can get it for you. Hope, as close to zero as possible, but that's kind of the situation. Maybe we can find someone to pay for it. Maybe the drug manufacturer can pay for it. We would be able to explore all of those situations for any of these kidney cancer take-home drugs, but
Mhm.
it's really case by case.
And exactly, and that's why we kind of tend to avoid personal questions, because there's so many variables within the question itself. But I would recommend, if you feel comfortable, the person that's asking the question, there's no obligation. Like if they join Haven and they find that it's not a good fit, or there isn't an answer that they were seeking, are they committed,
Oh,
Alan? Like,
no, no.
yeah.
Yeah, we get
So,
a few patients every month that we try,
mhm,
and they might choose to go to another pharmacy, or the answer is no, they need to try a different treatment.
mhm,
It's not always 100% that you'll get what you were hoping for. We
mhm,
will try. Like I think if
mhm,
if we say no, there's no other option. Like we will have turned every stone over possible.
yeah.
But it doesn't mean always 100%, that you will get the answer that you're hoping.
Okay. I would recommend then that if you have questions like this, reach out to Alan. And Mona, I'm really going to put you on the spot when I make a couple of announcements, but do you have the contact info that you could put in the chat by any chance?
I will find it.
Thank you very much. I do this to poor Mona because I can't find it myself, and she's very good at it. And I always do it at the end, and she's stuck. So I really appreciate what she does. It really helps us all a lot. Um, Alan, I can't thank you enough. This has been so informative, and I think this is such an important service to our patients. And everyone I have talked to has really appreciated what you do for them. I've had other patients say that you provided them a blood pressure machine, as you mentioned, and how
Yeah.
helpful that was for them, because hypertension is so attached to the drug that they might be um, on. And
Mhm.
Mona, thank you so much, because that was very efficient. So if you notice, Mona has put that in the chat, how you can contact Haven and Alan, and reach out and talk to them, and they may be able to help you with your personal situation. I'm just going to take a couple of questions, a couple of seconds to say this webinar has been recorded, and it's also available in French. It has been simultaneously translated for our French-speaking audience, and it will be available on our website. So you can revisit it and tap into the information, so much good information that we've had today. And we've also started putting our webinars on our YouTube channel. Mona, do you want to just tell them how to access our YouTube channel?
Well, the YouTube channel, you can find it on our website, kidneycancercanada.ca. And if you scroll down, there's all our social media icons. It's there. And I'll just put the link right now in the chat.
Well, thank you. Okay, that's great. So you can check us out there too. We're kind of making sure that we're more available for our patient community and our caregiver community. And I'm just going to take 1 second to advertise, so to speak, our next webinar. Often in our coffee chats, we have spoken about a program, was a clinical trial, and Alan, you may be familiar this with Gabriella Elie and Rob Rutledge, their cancer pet program.
Yes.
And it has now become global, and we're very fortunate. We've been working with them for a couple of years now, and they have developed a kidney cancer directed program. So I would recommend tuning in on February 20th, and you may have an opportunity to be a part of this pilot project. And it's a great opportunity. You get daily videos. They help with nutrition. They help with exercise. They help with mindfulness, because here at Kidney Cancer Canada, we do believe in treating the whole patient, mind, body, and spirit, because we need to be healthy in all ways. And often cancer patients really need some extra support. And I speak to that personally because I am a patient, and I realize how important, when one isn't working, sometimes the others aren't either. So I just noticed we had a couple of things pop up in the chat before we let everybody go. And thank you, Mona, for putting that in with YouTube. And I really appreciate everybody being here this evening. I hope you'll join us again. And Alan, I can't thank you enough. This has been really a wonderful learning experience.
Thanks for having me.
Thanks. Everybody have a great evening. Thanks so much for joining. Bye for now.